Hi, and welcome to another episode of STEM Seekers. I'm Sam,
I'm Josh.
and today we are joined by Dr. Mandaleson, who is an orthopedic surgeon based in Melbourne. Thank you very much for joining us today and sharing to us your story and your experience in orthopedics.
Thanks very much for the invite.
Yeah, no worries. So I think the first thing is, do you want to give us a quick briefing as to what orthopedics is and specifically what you do?
So orthopedics is a surgical specialty. There are multiple facets or subspecialties within orthopedics. It is predominantly a non-cancer field of surgery. You come through the progression from medical student to junior doctor, and then choose your surgical path that you either want to go down surgery, medicine, or some other specialty area. And in days gone by, when I came through to becoming an orthopedic surgeon, you just basically had to make that decision about medicine, surgery, or emergency medicine or anesthesia. I made that fork in the road in second year out of medical school, so as a resident, and applied to the surgical training program. Came through basic surgical training where I got to sample lots of different surgical specialties, and then came to another fork in the road as to what subspecialty I was going to choose. And at that point in time, kind of fell into orthopedics, to be honest. But orthopedics as a specialty mainly deals with bones and joints. So the full spectrum of age groups, from newborn babies with problems with walking or crawling, such as children with cerebral palsy, through to 80 and 90-year-olds who have arthritis or break their hips. So that is one of the main areas that attracted me to orthopedics, but that's it in a nutshell.
Mm. I understand like a lot of orthopedic surgeons have some background in sports, and I think that's what attracts them to orthopedics when they're choosing their specialty. I think you have some background in hockey, is that correct?
Yeah, background in a few different sports. And I wouldn't say that that's what drew me to orthopedics. Certainly, I had an interest in fitness and understanding of the human body and physiology and things like that. But I think the mentality more so of being proactive with treatment solutions, a patient population that wants to get better, and the ability of matching that with the skill set that we gain in orthopedics to be able to deliver that as an outcome. So things are broken, you fix it, they get better, and patients generally do well. So that basic sort of premise of regaining a level of activity and functionality was very attractive to me. And it's true that a lot of sports people are drawn into orthopedics, but I honestly don't like the kind of medical specialties that I was drawn to was emergency medicine, anesthesia, obstetrics and gynecology, certain areas of physicians training, ophthalmology. And so what I saw in common was two things. Those kinds of specialties that really had a major impact in people's lives. You know, if someone's going blind because of cataracts, having a preventable way of restoring quality of life was amazing. And the same thing with delivering babies. It's just very meaningful work. And the other aspect of my career choice was something that I could choose to do in low-income countries, you know, areas of need, and also regional and rural Australia, which is where my long-term plan was going to be for a long time, to settle in those areas. So having a skill that could be delivered in those settings.
Now that's a really broad spectrum, but how we narrow it down to you right now and what typical day kind of looks like for you as a orthopedic surgeon.
So let's take tomorrow, for example. I spend my day, it starts at about 8:30, 9 o'clock normally, if I've got full control of my schedule heading into a few days before Christmas. We're trying to squeeze a few extra patients in. So I'm starting at 8:30 under duress. But yeah, normally starts at 9. I leave home. My average day, I get up, I do the pack lunches for the kids. set up any sort of activities that the kids need doing, washing, doing putting a load of washing in, unloading the dishwasher, all those classic mum things or parental things. I shouldn't be gender specific. And then I go to my private practice, which is a 5-10 minute drive down the road for me. And I start seeing patients in consulting. And so I'd see a combination of patients that I've never seen before, and then I assess them for their problem, whether it be a child who's broken their finger or an older patient who can't open doors and taps anymore because they've got arthritis in the base of their thumb down in this area, and that's stopping them from being able to grip and squeeze and pinch. And so those new patients that I've never seen before, and I'm diagnosing their problem, I'm giving them a treatment option, and that sometimes can include surgery, but doesn't always have to. And then also seeing patients that I've also previously operated on, as well as patients that I've sent off for a treatment which is non-surgical, and sort of checking up on how they're progressing, to seeing if that's working, if that's sorted their problem, or whether now we've tried to optimize everything we can without the need for surgery, but unfortunately we're now at the stage where surgery is probably the only last option.
Mm-hmm.
That's my morning. So I'll probably see somewhere between 20 and 25 patients in the morning, and then I'll catch up with my staff in between patients or between morning and afternoon. I always have a hand therapist that I work alongside, so we're often working as a team, and my nurse and my administrative staff. So there's about 4 or 5 of us in the office. I love working as a team, and that definitely comes from sport, for sure. I think, with anything, there is not one person or one skill that miraculously makes someone better. It is always working. We're all cogs in the journey, and we all play our part. And the more that we respect each other's roles, and the patient too, patient is in the center of that, and we work towards giving the patient their outcome, but working together. And the patient needs to recognize that I'm not the fixer in this, that they have to own their journey of recovery, and it relies on everyone to play their part, including the patient's commitment to the rehabilitation after surgery. So so the whole team is there, and the patient will often see me first and then see the hand therapist, and then in the post-operative period see the nurse, and then the therapist again, and then me in different stages. So that's my morning with all of us being involved. And then I also run another company, healthcare company, which is trying to basically innovate models of care, improve accessibility to patients. And so in between those patients, I'm working with my other staff who will also catch up in the rooms, set direction, review marketing material, digital communications, potentially review trauma inquiries that come through that healthcare service, and then squeeze a bit of lunch or coffee in, and some sugar maybe to keep me going.
Jesus.
And then I'll have somewhere between 4 and 6 patients that I'm operating on in the afternoon at the same place. So at least I don't have to travel, but you're sort of juggling multiple balls, all utilizing a similar skill set, but different facets of my expertise, I guess.
But that in itself is like a crazy schedule. So like
Yeah.
did you say you started off at 9 o'clock?
Yeah. Well, I see my schedule is starting at about 6:30 when I start doing pack
6:30.
lunches. Yeah.
Yeah.
But, yeah.
And this is one day specifically.
Yeah, I try and set up my day so I do minimum travel, so
Yeah.
that I can optimize the amount of time that I've got. So when I get to work, the time that I'm spent at work is productive.
Yeah. And what time do you think you're on average finishing at?
I am trying to be better at finishing before 6.
Yeah.
But sometimes it might go through to 7:30, 8, 9. But that's a choice, and I don't say, if I said no to a patient who called up and said, I really need my operation because I'm traveling the next day or next week and I need to get it done, I could say no. I could say, sorry, I'll pass you on to a colleague. Or it's often hard to say no. And it goes back to the questions that you guys are at, or the stage of life that you're at when you're faced with multiple opportunities, leadership opportunities, sports opportunities, being a part of a choir or, an orchestra or something like that. Do you say no because you want to make time for something else, rest, but you feel like you're invincible when you're young? And this stuff is fun, right? Like I love operating. So why would I say no? And
That's true.
but you do have to carve out time for the other people in your life that are not related to work, your family and friends who you also want to have energy and time for.
So this like really depends on case by case, but do you think that flexibility comes from you specifically working in private?
It is flexible in the sense that the choice is mine.
Yeah.
If working and the choice is mine because, like I can run a business, but ultimately running a business has a bottom line. You have to cover your overheads. And so therefore you have to do a minimum amount of work to break even, right?
Yeah.
But then beyond that, you can say no, whether it's, 5% more, 50% more, 300% more, that is a choice, right? Whereas working in public, you have an income, a guaranteed income. You are not worried about covering overheads. However much you work or don't work, you're still getting paid the same. And so that gives you stability and flexibility in other ways.
Yeah. Do you think you could like compare more about private and public? Because I don't think a lot of people understand the difference. I think a lot of people would just assume they finish med school.
I certainly don't.
Yeah, they like finish med school and then you get put into a hospital. And then whether that's public or private, a lot of people don't really know. So yeah, do you mind breaking that down for us?
Sure. So I have taken a long time to understand this because I grew up in the UK and we only had a public system, and everyone's path was to be a public hospital employee at that time. In Australia, there is a public and private healthcare system. Medicare, which is the public funded healthcare system, is funded by all taxpayers. And it gives everyone an opportunity to access healthcare when they really need it, whether they've got cancer, whether they've broken something, or they're vomiting blood or whatever gross stuff, like which is an emergency. The public system has a minimum safety net, which is great. It also provides the opportunity to access healthcare in a more planned way, and that's called elective surgery or elective healthcare. But you then have to sit on a waiting list. So for that reason, the government has incentivized taxpayers to give them a bit of a tax break if they take out their own insurance, just like if you have home and contents insurance or car insurance. So you're covered if you really need big stuff that costs a lot, and healthcare costs a lot. So your insurance covers you for having a joint replacement or having a pacemaker put in or something like that, where you need to come into hospital and you want it done under your timelines. The patient can choose who they have to do it. They can do their research. They can choose which hospital they go into. So it gives the patient then control of what they want to do. But that often best works when you've got time to plan when to use it. Although it can be used in the private system as for an emergency setting as well. But then, the difference is maybe, the quality of the food or having a single bed in a private hospital, which may not really affect the outcome of the healthcare outcome, but makes a patient feel as if they've got something out of their private health insurance premiums all that time.
Yeah.
No, that makes a lot more sense now because I think not a lot of people understand that.
So with those systems, the way the doctors fit in, often doctors have the ability to work in the public system, the private system separately, or a combination of both. So in the public system, you get paid a salary. In the private system, doctors set their fees and then they claim part of their payment from health insurers and Medicare. All of medical school training is done pretty much through the public system. There are some private hospitals that take public medical or university medical students, but by and large it's through the public system, and all training programs are pretty much also through the public system. So if you want to be a physician, practicing a subspecialty in medicine, or surgeon, surgical training, anesthetic training, obstetrics is all done through the public system. It's really only if you want to be a GP after doing a certain amount of hospital training, then you go into general practice, which is all privately run, and you get more exposure of how to practice there.
Yeah, that makes a lot more sense now.
So for the specific kind of Monash uni, you're going through Monash, then it'll be through a public system. Is that right?
Yeah, that's right. Yeah, and you'll rotate through all the specialties. They have different clinical schools. So I went through Monash and was at the Alfred Clinical School, and the Alfred will have a network of smaller hospitals that you also go to, and to get your psychiatry rotations or obstetric rotations. So that you get that level of learning and exposure. And then all junior doctors are pretty much employed through public hospital systems, and not really until you finish, then do you get faced with the choice, do I go public, private? And that's based on multiple reasons that people choose, some financial, some from a flexible work-life balance point of view. Sometimes there's no options in the country. All people have to serve the community and generally work privately and publicly, because that's what the community demands. And there's not enough people to have a choice of, I'm only going to work in the public system or private system. You've got to do a bit of both.
I think you mentioned something about work-life balance, and I think Josh has a question on that.
Oh, yeah. So about this
There is none.
work-life balance. Well, could you extend on why is there none, and how you can kind of, if you do face burnout, how do you kind of avoid that in your own kind of perspective?
Sure. Well, it kind of goes back to what Sam was saying before about the path following school. So my biggest thing piece of advice I would give to high school students is take every opportunity to know yourself.
Yeah.
Okay. Know what wakes you up in the morning, gets you out of bed. Know what makes you feel good, know what drains your bucket, what fills your bucket. And you will keep refining that. But the more you put yourself out there, the more you will learn about those things. Because medicine is very consuming. It's consuming physically, it's consuming emotionally, morally. You work in a system that asks a lot of you. You have patience. You're at the coalface. So it's not like most other professions. The more senior you get, the more at the coalface you become, and more accountable you are to the patient. And if a patient is suffering or has a bad outcome, and you've potentially been part of that bad outcome, complication with a surgery, or they've come to you after some other complication from somewhere else, you bear that burden for each patient, and we don't take that privilege lightly. It is a real privilege, but I think it takes great strength of character, and that only comes with time and experience, and walking in other people's shoes, and that comes from living life. So the more you get from that, the more you'll realize why you do it, that you'll keep doing it, hopefully trying to avoid burnout, and also have people around you that you can debrief, that can support you through tough times. You will all go through tough times, like a career in medicine, a career in life, any pathway you choose, you will have tough times. So it's about knowing how to get yourself through that and creating some slack in the system so that you can look after yourself.
I think the medicine is pretty good in the sense that there is a good mentorship pathway that gives you the people around you. You get good support from the people around you, right?
Yeah, the good thing is that we are a tight-knit group of professionals. We go through as a cohort, we go through the same struggles. We can all relate, through tough medical school years, and getting into medical school is even tough.
Yeah.
What's that?
Bonding through suffering.
Yeah, that's right. I think, go through BCE is a bit like that, right?
Yes.
Yeah. And so, you go through your whole cohort, all of you doing the same rotations, the same, it's not like, you're having multiple different courses that you're choosing, and you might have one person that's chosen exactly the same courses. Your whole, year group of 100 or 200 people will have all gone through the same thing, right? So that's the start of it. And then when you go into rotations in your specialty training, orthopedics again is another one of those. One of the reasons I went through it is because there's a real tight bond within the cohort that you are training with, and that really helps support you again through a grueling training journey. Long hours, exams, stress. Technical learning, not sort of book learning as well. It definitely got me through.
Yeah. I mean, so you talk about the specialty training. Can you like outline what it actually involves coming from like after you finish medical school? Because
Yeah.
from what my impression of it is that it's actually really, really hard to get into these specialties, that people get rejected like again and again. I mean, we heard from Stan, who is the anesthetist, that there's a similar process when it comes to anesthesiology. Is it similar in orthopedics, or if not more competitive?
Yeah, look, I think, again, the more you progress down the career of medicine, the more we become in our own bubble. And we think, oh man, it's so hard to get in. But you think about the number of people that make it as a barrister or I don't know, a top corporate lawyer or whatever, I don't know, Médecins Sans Frontières, accepted onto, an international aid camp. It's very few. Or you become a tennis pro or a golf pro. It becomes very few. It's far more competitive than getting onto orthopedics, right? So we think it's really tough, but really in the grand scheme of things, it's not that. But it's also not a right or an entitlement for people just because you work hard and because you're a good person or anyone else thinks that you deserve it. Sometimes it doesn't go your way. And I think another thing I would say to high school students and junior doctors is to keep their mind open and have other things. And that's where, knowing yourself, you'll realize that there are multiple paths that make you happy. And you don't have to be dead set on one particular specialty. So my path, I was an intern for a year, then I applied to basic surgical training. I did, and then I moved from Box Hill, where I did my internship, which is Eastern Health, to St. Vincent's Hospital. I did my second year of residency, where I was doing lots of different surgical rotations. Then in third year residency, or halfway through my third year residency, I still had a plan of being a rural general surgeon, sort of having lots of different skills like fixing bones, opening up abdomens, fixing, blocked bladders and things like that. But somebody dropped out of the orthopedic training program in their final year. And I got done the orthopedic rotation as a resident. And they were working on me the whole time to try and change my career path. I wasn't still quite sure, but when somebody dropped out, they said, we can offer you a spot as a training registrar. So that's a more senior position. It's more of a pathway into then getting onto the training program. And then you sort of apply every year through a standardized application process, which involves looking at your CV. Now there's a sort of exam, a little exam that you have to do as well, and your references, as well as an interview, a standardized interview. And so I applied through that process, and I got on after 6 months of doing an unaccredited registrar jobs. And then I had a baby. So I deferred my entry onto the training program by 12 months. And then I started on the training program, and I spent 4 years on the training program across Victoria and Tasmania, and then had another baby, and then in amongst doing some overseas training as well, some what you call fellowship training. After 4 years of orthopedic training, I further subspecialized into hand surgery and upper limb surgery for 2.5 years, and then came back and settled settled in my current role.
Certainly. And basically, after you get into surgery, we might have some questions because when I just think of surgery, I think of blood, using tools, everything. What are some like common misconceptions about doing kind of hand surgery, these kind of surgeries, and whatnots?
With hand surgery, it's very controlled. There's not a lot of blood in the hand, or there shouldn't be. If you're doing if you're managing your cuts well and controlling things, so it's not too gruesome. There's a lot of different skills that you use. There's some big brute strength skills in orthopedics that we use. There is some finesse. There is a little bit of creativity sometimes. There is, like, we do microsurgery, so we're operating on things smaller than your hair. Putting things together. So I don't know if they're common misconceptions. It's hard, when you're sort of been doing it for a long time to sort of think what medical or high school students consider. Like my daughter did some work experience, and she was like grossed out by just even by the needle going into the neck to numb the arm. She was like almost fainted. So so I don't know. Like I've had medical students shadow me, like high school students, sort of year 10. And I think they think it's really cool. Like obviously I see what I want to see and I hear what I want to hear from them, but I think they really enjoyed this sort of team environment that like you're sort of in the zone of getting the job done. You've got your nurse who's scrubbed into theatre, you've got an assistant, and then you've got yourself, the anaesthetist, and they're all focused on getting that patient safely through an operation. We've got music playing, pumped up music, and it's all pretty chill, but then there's certain times where you're really focusing in. It depends on how high stress it is, but it's a pretty cool, fun environment. Like that. Yeah.
I think one misconception that I've heard, I don't know if you agree, is that orthopedics is a male-dominated specialty. I think you hear the phrase like, "Oh, he does orthopedics. He's an ortho bro," going around a lot of media. Do you think that's the case?
Well, certainly, I think, when I did orthopedics as a junior doctor, I definitely went in with that perception. I don't know how it came to be sort of implanted in my brain that that's what it was, probably just by the people that I'd been exposed to. I'd broken a bone and when I was young, they were all big, strapping men and like
Gym
I
bros
just
and with the creatine.
like I just kind of never saw myself as doing it because I was like, that's for big guys, right? And then when I got into the specialty, when I was doing it as a junior doctor, again, you sort of keep your mind open. You go, this is really interesting. And, there are lots of different types of personalities and people doing orthopedics. And it was the men that encouraged me. There were a few women on the unit as well, but they were really supportive. And I was like, if they think I can do it, why shouldn't I? And that gave me a lot of confidence to sort of pursue it. And certainly since being in the specialty, I've been involved with the Orthopaedic Women's Link, and that tries to shift that perception of it being a male-dominated specialty, right from high school student perceptions through to junior doctors, and trying to remove some of the barriers that stop women wanting to go into the specialty. Because there's certainly, you don't need to be strong. If you're often trying to draw on brute strength to get something done, then you're often doing something wrong. So I think most of the complications I've seen is by people hitting things harder or pulling things harder. Whereas I think if you don't have that strength, you realize to use your other senses and figure something out, which is often more safe.
Okay, well, we'll have to about wrap around now. But last question, what to our audience, to the high schoolers, what do you think? What would we say? What to look forward to in orthopedics?
What to look for? In what sense?
Like what's enjoyable and just like a warning, an advice, or anything like that.
Keep your mind open. If you are thinking about a career in medicine, orthopedics is quite different to other specialties, and don't rule it out. Like, it is a great specialty. It is So varied, so rewarding. Great bunch of people, great patients. I love it. I can't believe I didn't think about it earlier. But at the same time, if you are a high school student thinking, I want to go into medicine just to be an orthopedic surgeon, please keep your mind open, because I think the real reason you should do medicine is because you love helping people and working with people. And if you can find an area that fulfills all those skills and aspirations that you're suited to by knowing yourself, then there'll be multiple different specialty areas that you'll be happy in.
Yeah. Awesome. Thank you so much for taking time out of your day and the busy schedule that you've already outlined to us, just to speak to us. So I guess people like high school students can get a really good, accurate representation of what orthopedics is. So yeah, thank you so much for painting that image for us.
Yeah, thanks, boys.
Awesome. Thank you very much for tuning in for this video, and make sure to check out our other videos in our YouTube.
Yeah.